My name is Marley Haslam. I am a student in the San Juan Vett 215 Diagnostic Imaging course, semester spring of 2018. This is my state ID. This is my San Juan OCCI Distance Learning Certificate that I have posted in the facility. And this is my dosimeter badge with my name on it. I wear for radiology. My name is Marley Haslam. I will be performing task 1, lateral view of the left shoulder. I have my patient here who is laying down in left lateral recumbency. I have the unaffected limb that I will not be radiographing tied back and out of the way. I have the affected limb that I will be taking a radiograph of laying in a natural position. And then I also have the head and the neck pulled up dorsally to make sure that it's up and out of the way. I've made my measurements, and this machine goes off of weight, so I have the machine set for the weight of the patient. My MAS is 7.5 and my KVP is 62 for a measurement or a radiograph of the shoulder joint. When I'm collimating my x-ray machine, I make sure that it borders the proximal third of the humerus and the scapula. And my central ray is going to fall over the head of the humerus at the glenoid of the scapula. So once I've ensured that my measurement, my central ray is where I want it, and my machine is calipered to the area that I want it, I make sure that I have my proper PPE on. I have my lead-lined apron, my thyroid shield, my dosimeter badge, and I also have my lead-lined gloves that I will put on now. Make sure that all unnecessary personnel are out of the x-ray room. And then I just step back and take the x-ray over here. Okay. My name is Marley Haslam. I will be performing task 2, right stifle joint view in lateral recumbency. I have my patient here who is laying in right lateral recumbency. I have my limb that is not affected tied up and out of the way, and my affected limb that I will be taking the radiograph of in a right angle, lying on the table. And I make sure that when I'm positioning this leg, I'm going to center my central ray over the intercondylar fossa of the femur. I'm able to palpate that and make sure that my central ray is falling right over that area of the femur. And my collimation is going to border the proximal third of the tibia and the distal third of the femur. So once I make sure that my x-ray is collimated to the area that I want, and my central ray is centered where it should be, I put my marker in, make sure that my patient is selected. I've done my measurements. This x-ray machine does their measurements by the weight of the patient. So we have a technique chart. The weight of my patient is 8 kgs, so I've made the proper settings on my x-ray of the machine. My MAS is at 9.4 and my KVP is at 52. So when I'm ready to take my x-ray, make sure that I have all the proper PPE. I have everybody who's unnecessary to the x-ray out of the room. I have my lead-lined apron, I have my dosimeter badge, my thyroid shield, and I also have my lead-lined gloves. So I'll put those on. My lead-lined gloves on. And when I'm ready to take the x-ray, just step out of the view. Just make sure to step on my pedal. My name is Marley Haslam. I will be performing task 3, left lateral thoracic view of a canine. I have my patient here who is sedated. He is laying on the table in left lateral recumbency. I have his front legs that are pulled up cranially and the hind legs that are tied back caudally. I have my collimator open to border the thoracic inlet and the first lumbar vertebrae back here. I also have my sternum that's elevated up by my foam wedge, and I have also pulled the head slightly dorsally just so that I don't have any issues with visualizing the trachea. When I'm ready to take the x-ray, my patient weighs 65 pounds, and the x-ray machine at my facility goes by the patient's weight. My KVP is set at 90, and my MAS is set at 5. So when I'm ready to take it, I just make sure I have my patient pulled up, my machine is set correctly. I have my lead-lined apron on, my dosimeter badge, as well as my thyroid shield. And I also have my lead-lined gloves that I will make sure to wear. I have also removed all unnecessary personnel from the room. And when I'm ready to take my x-ray, I'll step back as far as I can within the x-ray room and shoot the x-ray that way. Turn this over here. And just double check my x-ray collimation one more time. Make sure that my label is in there as well. And we'll go ahead and shoot. My name is Marley Haslam. I will be performing task 4, right lateral view of the canine's abdomen. I have my patient here who is being positioned in right lateral recumbency. I have the head, just kind of covered and the legs pulled forward, semi-sitting in a natural position. I have a foam pad under the sternum to eliminate any rotation in the cranial portion of the abdomen. I also have my hind legs that are pulled caudally with a foam pad between the femurs to avoid any rotation that would affect any views or the way that the organs are laying in the caudal portion of the abdomen. I have my marker in there just labeling the side of the abdomen we will be taking. I make sure that my collimator is set to border the, you want the diaphragm to be in your view, so about T7 as far as your vertebrae go, you can kind of count to make sure that you're lining that portion of the abdomen to ensure that your diaphragm is in the view. You also want to border the femoral head to make sure that you have a whole entire abdomen in there, and you can distinguish all the artifacts in there. And when I'm ready to take the x-ray, I set my machine. My patient weighs 65 pounds and our radiology machine is set by patient's weight. So my KVP is set at 90 and my MAS is set at 8. And I also make sure that all of unnecessary personnel are out of the room. I have my lead-lined apron, my thyroid shield, my dosimeter badge, as well as my lead-lined gloves, which I'll put on now. And when I'm ready to take the x-ray, I'll just step back, double check my positioning, and I have my marker in there. I'll step over here to take the x-ray. My name is Marley Haslam. I will be performing task 5, right lateral view extended of the cervical spine. I have my patient here who is positioned in right lateral recumbency. I have my front legs that are pulled caudally in a comfortable position, not to be causing any discomfort or pain. I also have my head that is being slightly pulled cranially, and I also have a foam wedge under the mandible that is placing that under the mandible will eliminate any oblique positioning coming into play, and it will also make sure that the cervical spine stays parallel to the cassette. When I'm setting my collimator, I make sure that I have it border the base of the skull as well as the spine of the scapula back here, and make sure that I'm just open wide enough to get my whole neck in there as well as my marker. And so when I'm ready to take the x-ray, our x-ray machine is based off of weight. So this patient weighs 65 pounds. My KVP is set at 62 and my MAS is set at 8. So when I'm ready to take my x-ray, I make sure that all unnecessary personnel are out of the radiology room. I have my personal protective equipment on. I have my lead-lined apron, my thyroid shield, my dosimeter badge, and my lead-lined gloves. So I make sure that my patient is positioned correctly. I'm double-checking my measurements, my label is in there as well. So I'm going to take the x-ray. I'm just going to take a few steps back. When I'm ready to take it, just go ahead and shoot. My name is Marley Haslam. I will be performing task 6, VD view of the pelvis. I have my patient who is positioned in dorsal recumbency. I'm using a V-trough to hold the patient in that position, and the V-trough works really well to position the patient in a ventral dorsal position. I have my front legs that are being pulled cranially and are tied to the table, and then I also have my hind legs that I will extend and rotate when I'm ready to take the x-ray. When I'm setting my collimator, I want the collimation to border the crest of the ilium, and when my hind legs are extended, to border the distal portion of the patella. If you have a male dog, it's really easy to just border the tip of the prepuce. That's a really good way to kind of figure out where the crest of your ilium is. And I have my right marker in here to show the right and the left side of the pelvis. When I'm ready to take my x-ray machine is set by the patient's weight. My patient weighs 65 pounds. My KVP is set at 80 and my MAS is set at 8 by the patient's weight. And then when I'm ready to take my x-ray, I make sure that all unnecessary personnel are out of the room. I have my dosimeter badge, my thyroid shield, and my lead-lined apron. And I want to make sure that I'm really wearing my lead-lined gloves for this as well, since I will be positioning the hind legs for this pelvic x-ray. So when I'm ready, to make sure that my collimator is set on, you can see that my marker is in there as well. I'm going to come to the back part of the patient, and I will be positioning the legs for this radiograph. I make sure that I pull the legs caudally, and I'm going to rotate the legs so that the patellas fall over the trochanter, where the patellas should naturally lie. And then I'm going to just pull back, rotate medially both those legs, and go ahead and take the shot. My name is Marley Haslam. I will be performing task 7, performing dental radiographs on a canine. I make sure that I have my lead-lined apron on, my thyroid shield, I have my dosimeter badge out here, and then I also have my lead-lined gloves, just in case. Alright, so I will be performing my first radiograph on the upper left canine. I have my patient positioned in right lateral recumbency, and I have my plate positioned here underneath my canine, and I will be coming in and shooting my x-ray at a perpendicular angle to my plate. And I also have my marker here. If I need it to take full skull rads, I can do that as well. So when I'm ready to take my x-rays, I make sure that I have removed all unnecessary personnel from the room, and I have my proper PPE on. I'm going to step over here. And I have my x-ray machine set for the tooth that I will be radiographing, which is the canine tooth, as well as set for the proper side. So when I'm ready to take my x-ray, I will come and position my x-ray tube here, positioning it so that I'm coming at a perpendicular angle to that canine tooth here. And when I have it set at a place that I want it, I will step 6 feet back from the x-ray machine. Stepping about 6 feet back, and then I'll go ahead and take my x-ray. The next radiograph that I will be imaging will be the upper left premolars. I still make sure that I have my dosimeter badge, my thyroid shield, and my lead-lined apron. I have my patient still positioned in right lateral recumbency, and I have my plate up here placed underneath and behind all of my premolars back here, and then I have my tube positioned in an area where I can get the roots of the premolars in the x-ray. So when I am ready to take the x-ray, I have my patient positioned. I make sure that all the unnecessary personnel are out of the room, and I have my proper PPE on. I still have my x-ray machine set for the proper tooth, which will be the premolars, and then I will step 6 feet back from the x-ray machine and snap my x-ray. These are my instruments required for task 8, performing a GI series on a stuffed animal. I have my stomach tube here that's the size appropriate for the animal. I have my Ziploc bag that I will be using as the patient's abdomen. I have my examination gloves, some sterile lube, and a mouth speculum. And here we use a roll of tape. And here is my stuffed animal, and it is at least 18 inches long. And this is just showing that my stuffed animal is at least 18 inches long, and it is 23 inches from nose to tail. And this is the barium sulfate that I will be using to administer into the abdomen. My name is Marley Haslam. I will be performing task 8, performing a GI series on a stuffed animal. So I have my patient here, the stuffed animal that we have, who's being positioned in right lateral recumbency. So before we administer the barium, I will just be taking a scout view before we administer any barium so we can use it as a comparison. I have my technician who is wearing all the proper PPE, thyroid shield, dosimeter badge, lead-lined gloves, apron, and a thyroid shield. And then I have my lead apron on, my thyroid shield, my dosimeter badge, and I also have some lead-lined gloves as well. If this were an alive patient, we would not sedate the patient for every single radiograph that we're about to take, so we're simulating this as if the patient was not under anesthesia. So I have my x-ray machine set at the lowest kVp, and I'm going to restrain my patient. I've made sure to collimate this machine. If this were an alive patient, I would measure from about the last rib to about where the wing of the ilium would be. I make sure that the front legs are extended cranially, the head and the neck are resting in a natural position, and then I'm going to extend the hind legs caudally to make sure that we're getting a good view of the abdomen. And when we're ready to take the x-ray, make sure that my radiographic marker is in here, labeling the right side, and I'll go ahead and shoot. So I have my barium sulfate that I have mixed up. I have mixed it with 60 grams of this powder into warm water, and I have it mixed up in my bowl over here. Ready for administration. And so when I'm ready to place the stomach tube, I will first off start by measuring. So I have my stomach tube here. If this were a real patient, I would measure from about the very last rib to the nose. So I'm just going to kind of eyeball it here. Once I have my measurement, I'm just going to place a piece of tape around the tube so that I know exactly how far to administer, or to how far to place the tube when I insert it into the patient. So I'm going to put my gloves on. And I have my sterile lube that I will be using to lubricate the end of the stomach tube before placement. So I have my stomach tube with a little bit of sterile lube on the end of it. When I'm ready for placement, I'm going to place my mouth speculum in the patient's mouth. My restrainer will be restraining the patient to make sure that they're not moving or spitting out the speculum. And then I have my measurement tape placed. I'm just going to go ahead and gently insert the stomach tube into the patient. I'm just very gently advancing. And once I've hit my measurement, I'm just going to go ahead and stop there. So I have my stomach tube placed, I have my barium pulled up in my syringe, and my doctor has given me a dose for this patient if it were a real patient, but I'm just going to go ahead and administer a few syringes. I'm just going to slowly administer this through the tube. And then refill. Just again making sure that my restrainer is holding the patient in a nice calm way so that this can be administered without it being extremely stressful. And then I'm just going to go ahead and finish this off. And then once I'm done administering all of the barium, I'm just going to go ahead and very gently pull the stomach tube, making sure that the patient is staying calm, I'm not causing it any pain and stress, and that my restrainer is holding the patient in a safe way, and then we will remove the mouth speculum. So once we have administered the barium, you're going to want to let the patient just sit and wait for the barium to move through the digestive tract. Your first radiograph that you're going to take is going to be about 30 minutes after administration, and then the second radiograph you would take would be at 60 minutes after administration. And from there, if the doctor requested more radiographs, you would take one every hour until the diagnostic imaging is complete. So this is my technician that will be assisting me. In this case, the patient would not be sedated for these multiple x-rays, so we make sure that we have our dosimeter badges on, our lead-lined gloves, our lead apron, and our thyroid shield. I also make sure that, since I will be assisting as well, I have my lead-lined gloves, my thyroid shield, my apron, as well as my dosimeter badge, and make sure that it's out and showing. And then we're going to take the right lateral x-ray first. So I have my patient who's positioned in right lateral recumbency. I make sure that my restrainer is holding the front legs cranially, and I'm going to extend the hind legs caudally. I have selected my right marker to be placed in the radiograph. I would use my same measurements that I used for the first scout radiograph here. So I'm just going to go ahead and make sure my collimation is set where I want it and take the first radiograph. And then for the second radiograph, I'm going to take a ventral dorsal view. Make sure that I am collimating my machine to, if this were a live patient, about the last rib, and then to the crest of the ilium. Make sure that my x-ray machine is set. I have my marker in there. Just going to go ahead and retake this x-ray. Make sure that my forelimbs are extended cranially, and then I'm going to extend the hind limbs caudally, and then we'll go ahead and take this x-ray.